There are three main ways in which you can be at high risk. I don't think they're so fully understood. We've developed a risk calculator which is widely used and available. The three areas are really family history, essentially either two breast cancers in the family or a mother or sister with breast cancer under the age of 50 more than doubles your risk and makes you eligible for considering tamoxifen. The other major area are certain types of benign breast lumps, particularly atypical hyperplasia or any hyperplastic lesion. Atypia, which is quite rare, carries about a 4 to 5-fold risk of developing breast cancer and is very sensitive to tamoxifen with about an 80% reduction of breast cancer if women take tamoxifen. That's an obvious group that should be almost routinely offered tamoxifen, and they're not at the moment. The third group is probably the most important group in terms of public health because it's the largest. That is women with so-called dense breasts as seen on a mammogram. From a mammogram, you can do more than just detecting the cancer early, but the amount of whiteness or opaqueness on the mammogram is an indication of the amount of fibroglandular tissue there, which turns out to be very important in your risk of breast cancer. So women that have 75% of their breast covered with whiteness on a mammogram have about 4 times the risk of women with little density, and it's about 5% of the population. So this is an important group that we need to identify. And it does suggest that a really important way forward in breast cancer prevention is to make use of that first screening mammogram, not only as a detection of cancer, but a chance to review risk of breast cancer, to discuss what the options are, and maybe take preventive therapy if appropriate.